My name is Melissa. I'm a nurse here on Dunford West, which is a solid organ transplant unit. We have a good team. Everybody is really helpful. It's kind of like another family here. We spend a lot of time here, so we are, pretty comfortable with each other, talk about our personal lives, pets, kids, and at the end of the day, if anybody needs help, everybody kind of jumps in. So it's really nice. The last 5 years have been pretty amazing on Dunford West. I've learned a lot. Every day it's something new, whether it be a new medication I'm giving or about different etiologies that cause organ failure. I've learned a lot about the journey of a patient, how to be there for your patient and advocate for them. So far this morning, we've gotten report, pulled our morning meds, gone and assessed our patients and passed out the morning meds, which usually are the most meds we give in the whole day. So we'll give meds in the morning, noon, and in the evening. I was just pulling any 9 or 10 a.m. medication. Those are usually their anti-rejection medications. A lot of patients are on insulin because of the steroids, so the morning is when it's the most intense with medication. Hey, Mr. Howard. How's your pain? Are you nauseous as well?
Probably about 7.
But you've been walking around, you said, in the ICU?
Yeah.
That's
I
good.
usually go for a walk.
Well, we have 2 mobility techs on the floor right now. So if PT doesn't work with you today, they can get you up at least to the chairs. Mr. Howard actually just transferred to us from the ICU pretty recently, and he's doing pretty great and seems to be able to get up and ambulate. We'll continue that process here, and he could potentially go home with home health or go over to another facility here in the unit that does more intensive physical therapy. You need anything right now?
No, ma'am, I'm good. Thank
Okay.
you.
Pleasure. And then our other liver transplant patient, Mr. Diaz, he's also doing well, and he will probably go home. We're just watching his electrolytes a little bit.
Entonces ustedes me van a grabar, ellos van a grabar.
Sí, van a estar grabando. ¿Está bien?
Está bien, está bien.
My parents are both from Costa Rica, and I was born and raised in Houston. So growing up, my dad spoke to me in English and my mom spoke to me in Spanish. So now I'm fluent in both English and Spanish. This has been really beneficial to me as a transplant nurse and just as a nurse in general. When I have a Spanish-speaking patient, I can see that they feel almost like a weight has been lifted off their shoulders when they realize that I understand them and can advocate for them and help just translate even the easiest things like ordering breakfast. It really helps the patients out, and it makes me happy that my parents taught me Spanish, and now I can, help my patients and be there for them.
This is Dr. Booking. Are you calling?
Hi, Dr. Booking. Yeah, I'm with Mr. Eric Weathersby. He was under the impression that he was going to go home, so he just wanted me to call you.
So I thought the transplant surgeon team came by because they said they want to start first on the aspirin and Plavix tomorrow. Make sure there's no bleeding, and so they want to send him home first thing tomorrow. That's what the transplant team said.
What I find most challenging about caring for transplant patients is sometimes they come in and they get a transplant and they have way longer of a recovery than the patient and the family anticipated. It's hard to try to encourage these patients because, they are the ones that are in the hospital bed. It's hard to try to be positive and hopeful when these patients are going through so much. As much as you can tell them, the first year is a lot of ups and downs. There's going to be a better day that comes. It's hard when the patient this is all that they're seeing. So I think that is definitely the most difficult part.
I'm a former Marine, so, I believe in just doing things for myself. And so when it comes to somebody having to watch you and all of that, I don't like that, but that's what they do. And they do it, no problem. All of the nurses have been excellent. Some issue or something going on, they're right there. And they took great care of me. So I don't have, no issues. It's just me. I got things to do. I want out.
So Mr. Weathersby, this is his 3rd kidney transplant. He did require dialysis after. Sometimes it takes weeks to a few months for this new kidney to wake up, as we say, and he will be going home on dialysis. He was a little upset today because he thought he was going to go home. I was able to talk to the doctor, and we found out he was going to go home the next day. His mood seemed to change pretty quickly, I think, after he spoke with his family and kind of gave him an update that he would be going home the next day. So we just had the fire alarms go off. We'll find out soon if it was a drill or if it was an actual fire. So we are surrounded by some of the ORs, and that's usually where they have some fires, unfortunately.
Apparently someone was welding next to a smoke detector, and the smoke from the weld set the detector. There's no fire, but that's going to be flashing for a little while because the fire people had to come turn it off. It doesn't happen super often, but it does happen a fair amount. We do have the done OR right below us, and then right connected to that is the main OR, and the Bovies set off their fire alarm a lot, which sets off our fire alarm. So as you can see, everybody's really used to moving everything exactly where it needs to go. They were just thrown off by the fact that it was longer than it normally is when it's something that short. But yeah, everybody on our floor is pretty used to the fire drills.
Today has been a pretty typical day. Lots of meds, kind of busy morning. Mr. Howard, we checked on him after we gave him some pain meds and nausea medication, and he was feeling a lot better. So I'm happy that we found a pain regimen that helped him. Mr. Diaz is ready to go home. Hopefully he will be going home tomorrow. He is dealing with a little bit of anxiety. He's a little nervous to go home, and I think he feels a little bit of a burden, like, to his family, to now requiring a caregiver. Luckily, we have great resources for our patients, such as musical therapy, and it really helps patients kind of vent and let their emotions out in a way that they might not have thought about before. So we had our music therapist come and have a session with Mr. Diaz, and he really enjoyed it. And Mr. Weathersby, he was supposed to go home today, but they want to keep him. They've just restarted some of his anticoagulation meds that they held for his biopsy, so we want to make sure everything is stable before he can potentially go home tomorrow. When we get to finally see somebody go home that's really struggled and had a hard recovery, it feels amazing. It feels like you really helped that patient get to where they are, and that they're finally getting out of here. It's a feeling that I can't really explain. I feel like you have to be in that position to really know what it's like, but it's like, it makes everything worth it.